So, do we have Dr. Lokeshwari? She will be presenting Keratoconus family screening for studying prevalence in first degree relatives with corneal topography.
Good afternoon to everybody, and I would like to thank everybody for this opportunity to present in AIOC. I'm going to talk about Keratoconus family screening for studying prevalence in first degree relatives with corneal topography. Keratoconus development is influenced by both genetic and environmental factors. Screening first degree relatives helps to identify the prevalence and subclinical cases in keratoconus. So identifying subclinical cases aids in preventing the progression of KCN and thereby preventing the environmental factors which cause the progression of the disease. The prevalence of keratoconus among siblings has been increasing in recent times, but clinicians as us, we don't have a clear data on this. Keratoconus patients and family members, they often ask us, will my children also develop keratoconus, or what is the probability? And siblings of KCN patients ask if laser vision correction is safe for them. So our research question is, in first degree family members of keratoconus patients, by doing corneal topographical screening, can we know the prevalence and even the subclinical cases of KCN and compare their topographic parameters with that of the normal patients? So this is a prospective case control study done over a period of 6 months in a tertiary eye care center in South India. So with these inclusion and exclusion criteria, we assessed the following topographical parameters like Kmax, the 3 and 5 millimeter zone irregularity, thinnest corneal thickness area, and the posterior float. So 29 families participated in this. So we could do topographical screening of 59 first degree family members. So we found that 46% of them did not have keratoconus. In the remaining 54%, 39% were subclinical cases and 15% were frank KCN cases. And 82 of the 82 controls, we did the topographical parameters, we compared it with the 82 controls we had. So we found that using the chi-square test that there was no significant difference in gender distribution between the cases and controls. When we compared the topographical parameters, we found that via the Mann-Whitney test, all the parameters were showed statistically significant difference between the relatives and controls. Several studies, not several, but a handful of studies had been done in other countries like China, France, Israel, and California. So in India, this is the first study of this kind. And in here, we have found in our study around 15%. And similar trend was seen in California and Iran. And a higher incidence was seen in Israel and Lebanon. A slightly lower incidence in France. So the major limitation of our study was poor attendance among family members for disease screening. So usually only one parent accompanies the patients, or siblings don't accompany, or because of cost reasons, the entire family cannot undergo. So we recommend triple Cs, that is first counsel the family for regular screening, call them up regularly and remind them for a family screening, and the cost, try to reduce the cost when there is a family screening. We also recommend a multi-centered approach among different geographical locations and ethnic groups. So concluding, this is the first study of its kind conducted explicitly for family screening using topographical analysis. So we have some numbers to tell the clinicians now that it is around 54% the prevalence in family members. If the members asks will their children develop, then it may be, it is around 39% may be subclinical and 15% of the family members may have frank keratoconus. There is no role for gender in this. And if the siblings ask about their safety for laser vision correction, we have a statistical difference of topographical parameters, but a clinical significance is not yet determined. We need to study that. So these are my references. Thank you.
In one line, what is your carry-home message for the audience?
Please encourage all your KCN patients to undergo a family screening. If possible, reduce because if we take for a paying patient 2,000 to 2,500 per op scan, 10,000, asking them 10,000 per day is not practical. So try to reduce the cost and call them repeatedly if they don't come. When we identify a patient, they're going to come to us for regular follow-up. So even if that day they are not able to come, when C3R is planned or anything like that, please come repeatedly.
So from my clinical experience also, I can add that we all may agree to it, that cases of keratoconus are on rise. I mean, we have also become more conscious perhaps in diagnosing, and public has also started getting awareness of this particular problem. In our days, keratoconus, a very short note will come in theory paper and disappear. But now, it has really become a challenge. Uh, Keratoconus requires a day-long discussion. But I think it's a good study to begin with and to take care. Thank you, ma'am.
Thank you. Thank you.